For more on what this ruling means to patients and insurers, we bring in two doctors who know a lot about business, Fox News medical contributor Dr. Mark Siegel and Dr. Sreedhar Potarazu, CEO of Vital Spring Technologies. Dr. Siegel, first, you say this decision was actually more important than the Virginia decision. Why is that?
I think that, first of all, Attorney General Abbott had a great point here, which is doctors across the land are not buying into this. We're already full. We don't have the ability to take care of the 32 million more people, and we weren't asked. The reason that this decision is so important is because it's spoken about in very strong language, and I think it's going to fast track to this to the Supreme Court. I think before the Obama administration was trying to sandbag this. Now it's going to get to the Supreme Court.
Well, by the way, you heard what the Attorney General said. He said it could still take up to 2 years.
Boy, I hope he's wrong about that, because I'll tell you, the real problem here, David, and you've heard me talk about this, the problem is a euphemism that they deliberately threw into this. We're talking about health insurance. How can we mandate people to buy insurance which doesn't give them access to health care?
Dr. Potarazu, you know what I loved about the judge's decision? He threw in the broccoli mandate, you know, where they say, look, if you could be forced to buy health insurance because you're getting sick would be a cost to society, then you should also be forced to eat broccoli. Because if you eat broccoli, you will live longer and therefore be less of a drain on society. He used that broccoli. I mean, the extensions of this concept that the administration brought in are enormous.
I thought we were forced to eat broccoli, weren't we?
No,
isn't that part of the law?
Maybe your mother forced you, but luckily I'm on my own.
No, I think that's absolutely right, David. I think what Dr. Siegel just said in terms of health insurance is not a proxy for getting health care. And if people are going to be forced to buy health insurance, which hardly covers what they're going to need to take care of themselves, then we're really pushing people over the cliff. You know, in the State of the Union, the president said last week that we've got to drive more competition, we've got to drive more innovation. But if we are forcing people to spend more money for something of more value, forcing companies to spend on coverage that doesn't inherently have value to provide for care, then we're actually doing more harm than we are good. And the president is going to be best served by responding now as opposed to calling the bluff of the Supreme Court and waiting on the eve of the election, because that could be Russian roulette if he waits to see what happens.
What about insurers? One of the things that your organization, Vital Spring Tech, does is advises companies about how to buy the best insurance plan. Is this going to affect insurance rates at all? Because they have been skyrocketing.
Sure, absolutely. The mandate was to help insurance companies be able to pay for all of the people with pre-existing conditions they had to take on. If this is in limbo now, premiums are already going up. There's no means to hold these insurance companies accountable. I've been saying time and time again, we've really not addressed 80% of the market to help corporate America put the noose around the insurance companies, so they're going to still raise rates. And now the mandate, whether the Supreme Court rules on it or not, the fact of the matter is that the public today is not going to take it seriously. And even if the mandate still holds, it's not going to be enforced, which means that we still have a problem, and we still haven't allowed insurance companies to stop from raising rates. So we really fixed nothing.
In addition, I want to add something. 65 million people in this country live in underserved areas. That's the same that the 26 states that are fighting this cover. These people are not going to get health care because they're forced to carry insurance, because the doctors, the nurses, the clinics, the hospitals aren't there. It doesn't make any sense to force them to carry insurance.
By the way, has the AMA ever changed its position in supporting Obamacare?
They've acted nervously. They made a deal that didn't go through. They didn't get their doctor fixed, but no, they have not changed their position.
They represent what, Dr. Potarazu, about 20% of all doctors?
Yeah, it's not much more than that. But the AMA, just like every other lobbying group here, has sort of said what they needed to for party lines, and then behind the scenes have retracted their statement. If you look at the majority of doctors today, and I asked my colleagues, there isn't anybody that's happy about what's happening. Now, the president did say that we are going to make changes to malpractice reform, which is a positive step, but the proof is in the pudding of how much actually happens.
We'll believe it when we see it. We have to wait and see some action here. Sreedhar Potarazu, Mark Siegel, good to see you both, doctors. Thank you very much.